Welcome to Marian Ayurveda. In this episode, we are going to discuss an issue that is increasingly becoming one of the biggest problems today. Knee pain or knee discomfort has become so prevalent nowadays that it is hard to find anyone who does not suffer from it. Many people are also in a dilemma about whether they need to undergo knee replacement surgery or not. At this point, I wish to talk in this episode about what can be done in Ayurveda for this condition, what kinds of treatments are available, whether it is possible to avoid knee replacement surgery, and at what stages this is possible. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. Among the cases I see, knee pain is the condition with which I have the most experience in treatment. Or we have been able to save many people who were told they needed knee replacement through our treatment. From my experience in treatment, what I understand is that when a patient first comes in saying they can't bend their knee or can't walk, the initial difficulty they face at a preliminary level is that in all the joints of the knee, and as we know, there are many muscles connected to the knee. Muscles are attached all around the knee. There is swelling at the base of all these muscles. It's a kind of swelling that no one can easily get rid of. When this swelling occurs, that's usually when we feel pain. At that point, we tend to apply some kind of oil or balm. So what happens is, according to Ayurveda, the rule is that you should not apply oil when there is swelling. If you apply oil to an area with swelling, it tends to become more painful and the joint becomes even stiffer. This, to a certain extent, is considered to be one of the main reasons behind knee pain for many people. When this swelling is removed, about half the people within a day or two say that their knee feels free. I remember one patient who had to be supported by 2 or 3 people just to walk in. When I examined them, there was a significant amount of fluid accumulated in the knee. We simply did a treatment to drain the fluid, and after a short delay, the patient said, "I have started to walk on my own now." We didn't do anything particularly remarkable. We just used a few medicines to remove the fluid accumulation. This is just the first stage. Once the fluid is removed, in the next stage, what we do is focus on the muscles that help us to walk. More than the bones, as we know, whether we need to bend or straighten the knee, it is mainly the muscles that help us the most. The problems that occur with the muscles, now in this structure, what we see here at the front is a part called the rectus femoris muscle. We can see this tendon in this area. This muscle, the rectus femoris, passes through the width of this tendon and ends here. This muscle is considered the most important muscle. This muscle, the muscle fibers as they are called, are long thread-like muscles. If this muscle gets injured anywhere, or if instead of being straight, it gets twisted even a little, we will not be able to walk at all. You won't even be able to take a single step. We can find out by touching and feeling where this muscle is injured or where the muscle is misaligned. If we touch and check and correct it, from our experience, just by correcting it, you get immediate results. It doesn't take much time at all. By correcting these muscles, you can see results in just one day. So there is this one important muscle called the rectus femoris. By correcting this muscle itself, we can, to a certain extent, help those who are unable to climb steps or descend steps. For descending steps, it's actually different muscles that help us, the muscles at the back of the leg. Just by rotating and correcting all these, the person can immediately start walking and doing such activities. Similarly, what we have observed is that when people reach a certain age, say around 60 or 70 years old, and these patients come in, this is what we see. If you look at our own videos, if this is the front side of our knee, then at the back, especially when we look at our grandmothers or mothers, we can often see the muscles hanging down like this at the back. As we age, or when it becomes age-related, these muscles, due to a lack of strength and the effect of gravity, tend to sag downwards. And in most people, it looks as if a ball or a pouch is hanging with muscles inside it. If these muscles get locked in this position here, then these individuals will never be able to walk. If you have seen anyone with knee pain, you know that the muscles at the back of the leg, right now, these muscles are hanging like this at the back. And what we do is massage these muscles to correct them. As soon as these muscles return to their correct position, we regain movement in the leg. So that's it. And similarly, the muscles at the front as well, as we all know, after a certain age, all the muscles become loose and detached from the bones. That is said to be one of the main reasons why we are unable to walk. So what we do is there are 2 things we do for the muscles. First, we correct the muscles. If there are any faults or injuries, we correct them to their anatomical position. The second thing is, if there are muscles that are hanging loose like this, we massage them to tighten them. That is when you start being able to bend your knee again. Then the third thing we do is, as we know, there are ligaments in the muscles. These ligaments help keep the bones strong and stable, like the ACL and MCL, which are called cruciate ligaments. These ligaments may become loose and there may be small tears in them. So the treatments we do are aimed at strengthening all of these. So when our muscles have issues, what we see here like a wash, this red area underneath is what we call cartilage. It is when this cartilage is completely worn away that the bones rub against each other, leading to a condition where we can hardly walk. But even then, if we look at 100 x-rays, about 95% of people don't have any major problems with their cartilage. Only about 3 to 5% of people actually have this issue. It is only at that particular stage, even if it's minor, that we say surgery might be necessary if needed. Even then, in Ayurveda, we have certain medicines that can regenerate or revive cartilage. The only thing is, it takes a little more time. It is only when the medicine is taken regularly for about a year that we are able to regenerate the cartilage. So, through these kinds of treatments, as I mentioned earlier, by correcting the muscles and by draining this fluid, I have seen that about 95% of people experience relief from knee pain. Next, we need to strengthen the muscles. Once this is also done, I don't think we will have so many knee problems. This is also one of the most result-oriented treatments for us. At most, I would say for all this, about 7 days or a maximum of 10 days is enough. If we do all this, I feel that we will be able to solve all these knee problems. Let's meet again in another episode. Thank you.